Hello, my name is Sayam, I'm 29 years old, and from my perspective, I've been nearsighted for about 15 years. Today I'm going to have laser eye surgery. First of all, I'm doing it to get rid of my glasses. And secondly, my brother also had laser surgery. It went really well for him, so why not me next? I was a good candidate for laser surgery, so that's it. I went for it. The next step will be the operation, and I'm pretty confident.
Refractive surgery includes all surgical techniques aimed at eliminating the need for glasses. It is intended only for patients over 20 years old with stable vision. There are several techniques to correct this. The most common are laser procedure as well as implant techniques. Phakic implants for severe myopia or multifocal or trifocal implants for patients with presbyopia. Indeed, this is considered a comfort surgery by health insurance and is not reimbursed. However, many supplementary health insurances reimburse all or part of the procedure. They see an economic benefit in no longer having to reimburse glasses or contact lenses for their patients. The best technique is the one tailored to the patient. What is the process for a patient who wants to undergo refractive surgery? It all starts with a standard ophthalmological assessment to rule out any progressive or degenerative eye diseases. Next, a more thorough examination is performed, including a corneal topography to rule out diseases that are not visible to the naked eye, as well as aberrometry to precisely measure the optical quality of the image formed on the retina. At the end of the consultation, the refractive surgery specialist will be able to recommend the best technique suited to your case. How does a refractive surgery procedure take place? The procedure is performed exclusively with anesthetic eye drops. There is never any injection into the eye. The patient remains awake. The procedure is done on an outpatient basis, and both eyes are treated on the same day. Afterwards, patients are always surprised by how quick and painless the treatment is. What are the different types of laser refractive surgery techniques? The main laser refractive surgery techniques use the excimer laser, which corrects a vision defect by superficially reshaping the cornea. There are two main procedures: PRK, a surface technique, or LASIK. Both have comparable results after 3 months. PRK is performed in two main steps. The first step is to superficially remove the epithelium, and the second step is the actual refractive treatment. LASIK is a technique that involves 3 steps. The first step consists of creating a corneal flap. The second step is to mark this flap and lift it. And the third step is the actual refractive treatment, which uses exactly the same excimer laser that was used in the PRK procedure. The advantages of this technique are numerous, including visual recovery as early as the next day and a return to almost normal activities. The main reason is the preservation of the integrity of the epithelium, the thin superficial layer that is left intact during this procedure. What are the risks of laser eye surgery? As with any surgery, zero risk does not exist. However, serious risks are rare, exceptional, and difficult to quantify, which is why there is a methodical selection of both the patient and the surgical technique. There is a risk of post-operative infection. This risk already exists if you wear contact lenses. The main side effect of eye surgery is dry eye, which is inconsistent, most often temporary, and well managed with artificial tears. There is a question that is often asked: what happens if you move your eye during the laser procedure? You should know that the safety of lasers is now at its highest level. The latest lasers are equipped with eye trackers. It's a system that continuously tracks the eye in all its micro-movements. If fixation is lost, the treatment stops automatically. It is impossible to treat an unintended area,